All right, this is Dr. Brett here with Dr. Lydia, and we wanted to give everybody a little bit of a kind of a Q&A here session with Dr. Lydia. She specializes in prenatal care, pediatric care with kids from a chiropractic perspective. So I guess the focus of this from a information standpoint is around parents and not so much the kid.
Yep.
And the thing we see many times is there's a lot of parents we see that come in and they got the kids with them, and you notice this kid or the stories the parent tells you about the kid's been sick all the time, or they're dealing with this or they're dealing with that. And we as providers are like, why the heck don't you bring the kid in to have us help the kid?
Yep.
And it's hard for us sometimes because we know we can help them, and there's a little bit of a barrier with that parent. So I guess my question for you and for them is, what are some of those barriers? What are some of those things that a parent looks at and says, you know what, I'm not ready to make that step yet?
Yeah, a lot of it is education. So when you think of a chiropractor, you think back pain. And they always say oh, well, my infant doesn't have back pain, so they don't need to go see a chiropractor. So that's kind of a misconception that is a huge barrier.
Yep.
A lot of people don't realize as well, with normal medical model versus a holistic model, yes, there's been some, cross bridges that we can't necessarily come together with the medical world. So they think that we are trying to get kids away from antibiotics, different things like that, which in general, we're just trying to make sure that kids are well and that they develop. The CDC just changed their guidelines for developing and changing milestone markers and taking things out. And no matter if you talk to a pediatric chiropractor, OT, PT, we all say the same thing, that we shouldn't be doing that with our milestones. So that's kind of a big barrier as well, when you have another provider telling you it's okay if they skip crawling and just go straight to walking. So it's kind of hard to voice that and go against the
and
status
overcome
quo.
that perception.
Yeah, and that's been, general for most pediatric chiropractors for many years. Even chiropractors in general, we struggle to find that line as well, because there's many chiropractors who don't think kids should be getting adjusted either. So that's kind of the big one with parents, is just the education of why would my child ever need to go see a chiropractor.
Yep. So it's not necessarily a condition, but it's truly from a developmental standpoint.
Yes.
Are there any other myths that parents hear from somebody? They're like, oh, I don't want to take my kid there because of that.
They think that we adjust babies the same way that we adjust adults.
Yep.
So they think that you're just cranking on their necks.
They've watched too many TikTok videos.
Yep, exactly. So they just don't want you doing that to their kid. They don't know that it's a completely different adjustment. We also assess babies and kids way different. So they think, well, how are you going to determine that my kid has X, Y, and Z? They just don't understand. Again, lack of education, and then that fear of you're going to break my child's neck. How many adults come in and they're like, oh, I'm kind of nervous about you touching my neck. They're the same way with kids.
Correct. Yep.
So that's a big one too. And honestly, I think it's dads that we struggle with the most. Moms want the best for their kids. They want their kids healthy.
No matter what it is.
Yeah.
Yep.
And dads are typically the ones who are like, oh, they're fine. Rub some dirt on it, which is true in most cases. However, there are some things that definitely need to be helped with as well.
Is there I'm trying to think of a way to phrase this, but a doubt that parents have sometimes of okay, my kid has asthma. Why in the heck would a chiropractic adjustment make that better?
Yeah.
Or different other things like autistic situations on there, ADD problems that are on there, pee in the bed problems that are on there, ear infection problems. They're in their head. They're like, I've tried everything else. Nothing else has worked. Why the heck would this even be an option? Because why the heck would this ever work?
Yeah, a lot of it has to do with their nervous system more than just the symptom itself. So when someone tells me my kid struggles to pay attention in school, or they're wetting the bed, and everything comes back to the nervous system. So with kids, I focus on the nervous system, not the spine. Whereas with adults, most of the time you will focus more on the spine. So I completely look at the child's nervous system.
And that's what you use that one tool for, isn't it?
Yes.
To check that.
Yep.
It shows you.
It tells you heart rate variability, so how well their body is even recovering. And then what nervous system are they in? Are they in the parasympathetic nervous system where they're sleeping, they're digesting, they're developing? Or are they in sympathetic, which is essentially your gas pedal is on and they're like trying to run from a bear, but they literally can't because they don't know how to crawl.
Yep.
So, and a lot of that comes from prenatal stress and then birth trauma. And it's not even like people who are like, yeah, I just had a regular vaginal birth, everything was fine. They don't realize like that pulling that nurses do on a baby's head.
Normals still abnormal.
Yes. And so it's like that little pressure on a baby who's so pliable puts so much pressure in their neck and in their head, and you have all of those nerves in there. So the biggest nerve that I focus on is the vagus nerve. It really controls everything in our body. Mm-hmm. So a lot of like your ADD, your ADHD, autism, asthma, digestion, latch issues, everything from that comes from that nerve because that controls everything, and it's found right there at the base of your neck, and that's exactly what is pulled during that birthing process.
Yep.
So that's really what I focus on with that, and most people don't think that that is a neurological issue because they've always been told your kid's just hyper.
Yep.
But a lot of it is their nervous system saying something is wrong.
It's on overdrive.
Yeah.
And you're finding that not by guessing, but by doing an assessment that gives you objective data to see it.
Yes.
And then your approach to it is very specific to that specific problem that you can then recheck it to see that, you know what, there's actually change in this that ultimately, given some time, will change the symptom as well too.
Yes.
Without pills, without other medical intervention on that line.
Yeah.
So.
And it's crazy what you can see change in a child. Just going from like not even thriving to then thriving is a huge change that a lot of people don't realize. And they think, oh, I need to stop breastfeeding and I need to put them on formula because they're not getting enough weight. Things like that, but it's literally their body saying, I'm not thriving. Help me.
The juice isn't on.
Yeah,
type of thing.
Babies can't tell you that. Kids can't tell you that.
Yep.
And I mean, even struggle with parents when I tell them like I have specific technology that helps hone in and tell me what's going on with your child. They're still hesitant because they also don't trust that. But this is backed by so much research, way more than what chiropractic is in general. So I'm not just like adjusting willy-nilly when I adjust kids. I'm adjusting based off of what those scans are telling me.
And it's individualized per kid, based upon what's going on with them.
Yeah.
On that end of it.
And I think it's way more specific than I think what we do with adults.
Yep.
Even when I get adjusted and when I adjust adults myself, like what I do with kids is way more specific.
Yep. And most kids, I mean, I've been by your room before, and my kids get adjusted by you as well too. Like, they enjoy it. Yeah. It's not some like fearful, scary, volatile thing that goes on. Like, they go in there and they leave and they're smiling, type of thing. And even my kids, like, they like love coming to see you because the fact that, one, their little bodies know something good's going on, as well as two, what you're doing with them is not a scary process on that end of it. So awesome.
And you can adjust them in any way. You can adjust them while they're playing with a toy. Yep. So it makes it nice and easy for them.
Yep. Awesome. Well, hopefully you guys get something from that, and it answers some questions that you may have in regards to kids, because we get the question like, what are kids doing in here? And people just, again, to your point, lack of knowledge creates an uncertainty, and uncertainty keeps people from moving. It paralyzes them many times, and hopefully some of this stuff will create a little bit more understanding and a little bit more certainty behind why you would bring a kid in here, just being willing to take that step. And even if that step is simply to get an assessment and find out, is this something that can help my child? Because what I'm doing is not working right now. Like, that's the only thing we ask you to do is take that first step to see if this is a viable option for you. I mean, it can be scary, but there's thousands and thousands of parents that do it every single day. And they consistently say, I wish I would have done this sooner. Yep. On there. So again, we look forward to seeing you soon. If you got any questions on this, please reach out to us and get a hold of Dr. Lydia, and she'll be more than happy to give you guys some answers.